Good morning, everyone. This is Frances Horn, the Employee Benefits Compliance Officer, and I'd like to welcome you to JRG Advisors' presentation today on the employer reporting requirements under the Affordable Care Act. I want to go ahead and make you aware that if you have questions during the presentation, you can go ahead and type them into the question box, and then make sure that you hit send, and we'll receive it and then answer it at the end of the presentation. Also, another reminder, we will be sending out a copy of the replay of today's webinar and also any question and answers that we have. So you'll be getting a Word document on that. So with that being said, let's go ahead and start. Now, the agenda, it covers a lot of information, and even though we're not going to be going into the weeds, into really fine detail, this webinar is still jam-packed with information. The sections of the Internal Revenue Code that have been implemented by the ACA hold significant mandatory reporting requirements. There are specific forms that have to be used, there are deadlines that have to be met, so it's really of the utmost importance to understand what needs to be done and by whom, so you can start putting processes into place. So our agenda, we're going to have a brief information on the background. We're going to describe the reporting requirements under the two Internal Revenue Code sections. And then we're going to look at a matrix that we're going to be offering to you as a tool, talk about some takeaways, and then look at those questions that you have. So the Affordable Care Act, it really represents the most significant overhaul to our healthcare system since 1965. And I'm not sure who's on the line, but I remember 1965, and that was when Medicare was enacted. And the Affordable Care Act, though, was enacted for the purpose of increasing quality and affordability of health care, expanding public and private insurance coverage, and reducing health care costs for individuals. So what the Affordable Care Act did is it provides various mechanisms so those goals can be met. And some of those mechanisms that were implemented were, first of all, what we know as the individual mandate. And this is the requirement that all U.S. citizens have to be covered with what's considered minimum essential coverage. We reference that as MEC, or they have to pay a penalty. And we know that the penalty for 2016, I believe it's like $695 if we don't, provide, if we're not covered with health care coverage. The next mechanism that was put in place is in order to keep coverage affordable for certain individuals, there's a premium assistance subsidy that's available if someone gets coverage on the exchange. And again, meets certain requirements, such as certain income requirements. And then finally, it's expected that employers, that they have to be good citizens and provide health care coverage to their full-time employees and not steer them to go to the exchange all the time. So there's a mechanism to go ahead and actually make you meet that requirement. It's called the employer mandate, and it penalizes employers of a certain size who either don't provide health care coverage or coverage that isn't minimum essential coverage, minimum value, and affordable. So we all need to be aware that the IRS is the agency for enforcing these provisions. And I think that it was recognized early on that the IRS probably couldn't do all of this by itself because it has to police all group health plans all over the country, and we know that the IRS has been downsizing over the recent years. So basically, how are they going to meet the requirements? Well, the Affordable Care Act gives mechanisms to provide assistance to the IRS. So basically, you're kind of going to become the IRS's employee because you're going to be doing some self-reporting and providing them information so they can do their job. So again, this mechanism provides assistance to the IRS for oversight of all these reporting requirements. And the first one we're talking about comes under the Internal Revenue Code, Section 6055. And this assists the IRS with the individual mandate. So reporting is required as to who is covered with minimum essential coverage. This reporting also helps individuals prove to the IRS that they had coverage. And when the IRS looks at their form that they're going to receive, it will say, this person was covered, we can't penalize them. And as a reminder, the forms that we're talking about, the individuals may need to go ahead and file these with their income tax for next year. So when we're talking about compliance as to the MEC reporting, we look at a Form 1095B, which is an employee statement that is going to be given, again, to individuals covered. And then we look at Form 1094B, which is a IRS transmittal form. Again, goes to the IRS. So those two forms together equal compliance under Section 6055. The next section we're looking at, Section 6056, is also referred to as the applicable large employer, or ALE reporting. And as a reminder, an ALE is required to offer MEC to at least 70% of its full-time employees and dependents in 2015. Now that number increases to 95% for 2016. If you don't offer coverage to that percentage, you could be subject to a $2,000 annualized penalty if only one of your full-time employees goes to the exchange and gets a subsidy. Additionally, if the coverage offered is not minimum value or affordable and a full-time gets a subsidy on the exchange, the employer could be subject to a $3,000 penalty. But that penalty is only applied to each full-time employee who would get a subsidy on the exchange. So again, the purpose is that we are telling the IRS, yes, we offered coverage, it was minimum value, or maybe it wasn't minimum value. So the employee knows too is, geez, the employer offered me coverage, I shouldn't have tried to get any type of subsidy on the exchange. And again, just want to go ahead and remind you, this is really a self-reporting mechanism. You're going to be telling the IRS information, and then they'll come back to you if they have questions. So compliance under 6056 equals the Form 1095C, again, goes to full-time employees, a Form 1094C, which is a transmittal form to the IRS, and that equals compliance. So let's start talking a little bit about 6055 in depth. So who's going to be actually responsible for this MEC reporting? We're going to see every employer does not necessarily have to report this information. First of all, what's reported is that any plan that provides MEC provides report to any individual covered during the calendar year. Now, when this report is completed, coverage is going to be reported on a monthly basis. But the report is not filed monthly. It's only filed annually. Also, as a reminder, for an individual to be reported, they only have to have minimum essential coverage for 1 day in a month. So let me give you an example, and it may not be a good one, but it's an example. So I come to you and I start working, with you on June 1st, and you give me coverage on June 1st, and so I'm covered that day. I come in on June 2nd and say, this is not working out, I'm leaving. So you would actually, if you were responsible for reporting the MEC, you'd have to report coverage for me because I was covered for 1 day in that month. Now, the good news is, who does this reporting? For fully insured. So if you're sitting there and you have a fully insured coverage for your employees, the health insurer or the carrier is responsible for reporting this information. Now, if you happen to be a self-insured employer, a self-insured employer of all sizes that provides MEC to any individual must do this reporting. So what this tells us is the MEC reporting obligation comes from the type of coverage that is offered, fully insured or self-insured, and not the size of the employer. We have a couple of bullet points here. Again, it talks about the self-insured, but also if we have any governmental employers on the plan, we want to make sure that, you're responsible for this reporting also. However, you have the right, which a private employer doesn't have, that you can designate someone else to do this reporting for you, whereas private employers don't have that right. So, what is MEC? I think that's probably been the question for the last 5 or 6 years, ever since the Affordable Care Act was enacted. And MEC, it's a very broad concept as to coverage, and it's a very low standard. It's broad in that it encompasses basically every type of coverage. especially any type of coverage that you as an employer would provide, as long as the coverage just isn't a dental plan or a vision plan or a health FSA. So if you have a PPO, a POS, a high deductible health plan, those are all considered MEC. Also, governmental coverage, such as Medicare or Medicaid or TRICARE, is also deemed MEC. So that's a broad concept. As to this low standard, MEC doesn't have to be a minimum value plan. So it could be what we call a skinny plan or a bare bones plan. The requirement is, as long as that MEC coverage provides preventive services, it'll meet the requirement. So we just have a note here, though, what we don't report for. If you're making contributions to an employee's HSA, health savings account, you don't report that. If you've implemented any type of wellness programs also, you don't report any kind of information on that. So let's briefly talk about really what information are you going to be giving to the employee and to the IRS. First of all, it's going to be the name, address, EIN, general information of what's called the reporting entity. Remember, if you're fully insured, the carrier would be reporting, and they're the reporting entity. And then also you have to include the name, address, Social Security number of each responsible individual. And generally the responsible individual is the employee. However, the IRS has just made a note to say, we call it the responsible individual because it may not be the employee. Maybe you're covering someone under a qualified medical child support order and they're not an employee, but they still would receive a report. We've mentioned you're going to report the months of coverage. And again, someone only has to be covered for one day in that month. You're also going to be putting some type of contact information. If the employee has a question or if the IRS has a question, who will they call? What's that telephone number? So we're going to be repetitive as to these form numbers and names, only because, first of all, they can be confusing, and naturally the more we hear it, I think it'll help to sink in a little bit. So again, the 1094C goes to the responsible individual, and the 1094B goes to the IRS with any copies of 1094Cs that have been issued. So on this slide, what we wanted to do is we want to show you actually what this form looks like. And this is the form 1095B. Again, it's going to be going to covered individuals with MEC, and it would be used by small employers who are self-insured, or it would be used by a carrier or insurer for someone who's fully insured. So I've got my little guy here reminding you, if you're a fully insured employer, don't worry, you don't have to do this form. And also, we keep mentioning about self-insured employers because it really is becoming a trend now that even employers with as few as 25 employees are taking the self-insured route. They're dropping their fully insured, and they're taking on that coverage responsibility themselves. So again, just wanted to mention why we keep talking about self-insured. On this slide, we want to go ahead and show you a copy of this Form 1094B. Again, this is provided to the IRS along with copies of that 1095B. So again, a small employer, if you're self-insured, you would be sending this. The carrier or the insurer would be also completing this. Our little reminder there with our, geez, he's not smiling, is he? But fully insured employers, you do not complete this form. So we've gone through 6055 rather quickly, but sufficiently. Now let's start talking about Section 6056. And this is the applicable large employer reporting requirement. Now, under the employer mandate and 6056 reporting, an ALE is one who employed 50 or more full-time or full-time equivalent employees in the preceding calendar year. ALE reporting is based on an employer size, not whether they're fully insured or self-insured. So if you had 50 or more full-time employees in 2014, you're going to be responsible for coverage that you offered or maybe even didn't offer. If you didn't offer coverage, you still have to do a report for 2015. When determining your size, every employer member who is under what's called a common control group or common control is considered in total to see if there are 50 employees. And so we have a brief example here. We've got Joe. And Joe's pretty industrious. And he has, he has a pizza shop that has 20 full-time employees. He's got a bakery with 20 full-time employees and a tire shop with 20 full-time employees. Now, if we would look at each of Joe's companies individual, we'd say, well, none of them have 50. He's not responsible. But what the IRS has said, no, since Joe owns all of these companies, that's called a common control group, and we look at them in the total. So in the total, Joe has 60 full-time employees. Thus, it makes him responsible for the employer mandate and for this information reporting that we're talking about today. I want to go ahead and remind you, when we say that Joe owns it, that's basically Joe is the parent and he has subsidiaries. But there also can be other additional business relationships which form a common control group. So you need to be aware of that. If you have any questions, you might want to go ahead and talk to your tax advisor or legal counsel on that. So in our example, 3 companies, they're all subject to the employer mandate and all subject to the information reporting requirement. Also, as another reminder, we received information that when you're determining whether you are an employer, a large employer, that employees who are considered covered under Veterans Administration care or TRICARE, they are not counted as a full-time employee. And this not counting those individuals is only for determining your size. If you know that you're over 50, then you still have to include those as the offer of coverage or providing coverage at its minimum value. So the next thing we have to talk about is, what about if I'm an employer that I only had between 50 to 99 employees in 2014? We know that you may have been eligible for what was called transition relief as to the employer mandate, such that you didn't have to really offer coverage until 2016. However, if you're an employer of that size, 50 to 99, the IRS refers to you as a mid-sized large employer, you do have to comply with this reporting requirement. Again, it's 2015 coverage, and it's reported in 2016. So some employers, they're a little bit confused about this, but be aware you do need to do this information reporting. On the next slide, again, start delving into the forms a little bit. We're talking about Form 1095-C and 1094-C. First of all, Form 1095-C is the form that will go to your full-time employees. This form goes to every full-time employee as long as they were full-time for at least 1 month in the year. So, word of caution here, you need to start thinking about employees you may have had turnover. Maybe you had someone who only worked 1 month for you in 2015. You would still be responsible for reporting information on them. So I think I wanted to give an example, but I think I expressed that. So if someone only worked for the month of February, again, even though it's only 1 month, you would still have to go ahead and give that form. Now, if you're a large employer, over 58 full-time employees, and you're self-insured, this Form 1095-C has a dual purpose. It's going to serve for the purpose of reporting that MEC coverage and reporting the offer of coverage that you had to make. And again, 1094-C is the form that goes to the IRS. So we want to know, what actually are we reporting to the IRS and full-time employees? Again, general information, the name, address, EIN, contact, telephone number for the employer, and then also for the employee, name, address, social security number. You're going to be reporting for all 12 months in 2015 the coverage that was offered, and you're also going to be reporting the employee-only cost for the lowest base plan that you have. Now, there's also a lot of information that has to be included. So you have to say if you offered coverage to a spouse or if you offered coverage to a dependent. And in order to streamline the process, what the IRS did is they created a lot of indicator codes that are going to be going on these forms. And there's two series. And one is called the Series 1 codes. And they go from 1A to 1I. And again, it talks about what kind of coverage did you offer. Did you offer minimum value only to an employee? Did you offer it to the employee and a dependent, or to the spouse? The next series of codes are 2, and they go from 2A to 2I. And then it just basically, again, is reporting why you may not have offered coverage or that you covered the employee. So again, a lot of information, especially after these indicator codes. Excuse me. I have here about there's some alternative reporting. And again, in the time frame that we have today, to delve into the alternative reporting, it wouldn't be time efficient. And also what we're finding is many employers can't use this alternative reporting. So it's kind of like a red herring that the IRS has thrown out there to us. It's something that says, yeah, here's something you can use, but again, most employers can't use it. So we also wanted to show you a sample of the 1095-C form, again, that goes to the full-time employees. And also would go to any other individuals covered under a plan if you're self-insured. So this form is used by large employers, whether you're fully insured or self-insured. However, as our little red box there indicates, if you're fully insured, you're going to complete parts 1 and parts 2. And if you are a self-insured large employer, you'll complete parts 1, 2, and 3. Now, try to fill a little bit of information in there just so you get a flavor of what has to be completed. So if you look at that part 2, those are samples of those indicator codes that I talked about. You'll see for the first 3 months, I put in there a 1H. A 1H would tell the IRS, I didn't offer coverage to this employee. If you go down to line 16 in part 2, you're going to see that I have in there a 2A. And I've coordinated my codes because one line I say to the IRS, I didn't offer this employee coverage. But then when they look at the 2A, it says, geez, this employer didn't offer coverage because this individual wasn't employed at that time. So this might be a sample of an employee who only started working for you as of April. So you see we have one code for January, February, March, and then a different code goes from April to the end of the year. That code 1E, that would tell the IRS that you've offered coverage to the employee, the spouse, and a dependent, and that it was minimum value. I kind of glossed over line 15 in this part 2. Line 15 is where you indicate that employee-only cost for your lowest cost plan. A word of caution, if you're completing this form, you have to put the exact dollar amount in there. You can't round up and you can't round down. So if coverage is, I think I indicate like 106.50, you must put 106.50. So again, you can't say, oh, geez, it's only 106 or 107. On the next slide, this is a sample of a Form 1095-C, again, that goes to the IRS. So again, you as a large employer, you would be completing this, whether you're fully insured or self-insured. Now, this sample only shows 2 parts of the 1094-C, but there are 4 parts, and we just couldn't fit everything on one slide there. So again, just showing that you're completing the employer information, your address, your EIN, contact information, and then also it shows that you do have to sign and date it. So the next couple of slides, what we want to go ahead and talk about is information that's applicable regardless if you're reporting under 6055 or 6056. So we've talked about that this 1095-C, especially if you're a large employer, goes to full-time employees. How can you get that out to them? First of all, it can be distributed in the same manner as you do your W-2. So you can mail it to them first class. You can give it in-hand delivery, maybe inter-office delivery. You can also submit it electronically. However, if you're going to do something electronic, you always have to receive the employee's consent before you send that document. Now, as we've been talking about these forms, and as you see what deadlines are going to meet, these forms are very analogous to a W-2. And we even mentioned you can deliver in the same manner as a W-2. As to delivery, the key difference, you know that if an employee terminates in the middle of the year, they can come to you as an employer and say, I want my W-2 now. I don't want to wait until January 31st of next year. And you would be required to give that W-2 within 30 days. However, with this 1095-C, if an employee does leave in the middle of the year, they can come and request the form. However, you're not required to comply. If you want to, you can give the form. However, if you don't want to, you can say, we'll give it to you next year when required. The key is be consistent. You know, don't change in midstream the way that you're handling the 1095-C. On the next slide, let's go ahead and talk about the form and the due dates. The first thing that we want to remind you is that all of this reporting is done on a calendar year basis, January 1 to December 31st. So some of you on the call, you may say, well, geez, but I offer coverage to my employees, but the plan year policy doesn't start until March, or it doesn't start until June. You still have to report based on a calendar year, regardless of when your coverage starts or when your policy year starts. As to the reporting requirements, again, just like a W-2 or any other document that goes to the government, if that due date falls on a Saturday, a Sunday, or a holiday, you move it up to the next business day. So looking at our first box there, the Form 1095-B and 1095-C, again, these go to individuals and full-time employees. It's required to be provided by January 31st of 2016. These are the individual statements they receive. As to your transmittal that goes to the IRS, that's in the golden colored box, and that's the Form 1094-B and 1094-C. If you are under 250, going to be filing less than 250 forms, you can file by paper, and that would be due February 29th, 2016. And that's because we have a leap year next year. However, if you're a little bit larger and you'd have to file 250 more forms, you must file electronically, and then you file by March 31st, 2016. I want to go ahead and mention, maybe you don't have 250 employees, but maybe you might have 50 or 75. You have to remember, if you have a turnover situation, you may be getting up to that 250 number. It all depends what your industry is and how high your turnover is. So again, that's when the forms are due. And what discussion on any type of IRS reporting would be complete if we didn't talk about penalties? So the penalties relating to these forms, again, are very analogous to the requirement to file a W-2 and a W-3. And the penalty for failing to file a report, and that means the information that goes to the IRS and the statement or the report that goes to the individual, this number is, first of all, it's mind-boggling to me. And why I find it mind-boggling is because when I was first talking about this early in the year, that penalty was $100. And then, based on our Trade Act, there was a provision put in the Trade Act, and it increased the penalty for this filing of an IRS form up to $250 per return, with a maximum of $3 million. And then finally, just last month, when the IRS put out its tax adjustments and its penalty adjustments, it increased it to $260 per form, or a maximum of $3.1 million approximately. So first of all, you need to be aware, I think this is a very steep penalty, And the key is, if you don't do your filing, that's when this penalty could be applied. Now we talk here, this penalty could be waived by the IRS if it is due to reasonable cause and not neglect. You know, I don't think if you would tell the IRS, oh, the calendar just slipped away and I forgot what date it was, so I was late in filing. That may not be a good reason for the IRS. The other thing that we want to talk about is the penalties. Remember, this is the first time everyone's going to be doing this filing. No one is going to get it perfect. You may put a Social Security number in a wrong place, or you may put a date in a wrong place, or you may transpose a number. So the IRS has said that if if there's incorrect information, if it's, again, just misinformation, then they'll probably be lenient as to penalties. However, what they really are stressing, they want to make sure that you file. So even if you think something may be wrong, do your best effort. Make a good faith effort to be as correct as possible, but be ensured that you do a timely filing, because that's where the penalties could be kicking in. Also, we talk about errors. Again, errors are going to be made, and the IRS has told us if you make an error, you do have to correct them. You have to send out a corrected form. We give you the website for the 2015 instructions for the forms. The instructions do go through the process that if you find that you've made a mistake, how you can go ahead and correct it. And personally, and surprisingly, I think the instructions are pretty clear and they're pretty easy to read as to go ahead and making these corrections. And the next thing, we've talked about there's a lot of information. There's a lot of data gathering that you have to do. And previously, the IRS didn't talk about an extension. However, when it gave us final instructions in September of this year, it did include an extension process. So if you don't believe that you're going to meet your requirement to file your form, your 1095B with the IRS, then request an extension. With the form that goes to the IRS, you do have to send in a request, and it's on Form 8809. And with that, you will get an automatic 30-day extension. You file it, as long as you file it before the day that the form is due, you would get that extension. However, if you think that you're going to be late in getting the form to your full-time employees, it's a different process. And first of all, this extension is not automatic. It must be granted to you by the IRS. And how you can get this extension, and again, it's for 1095Bs and 1095Cs, you submit a written letter to the IRS. It has to be postmarked no later than the date on which statements were due to the employee. You include your name, your EIN address, the type of return, and a statement requesting an extension and the reason for the delay. So again, this is where you need to be really cautious here, because we don't know how the IRS is going to treat these extensions. If you send in a request and say, geez, we had personnel changes and we forgot to do these forms, they may not give you that extension. And again, we keep stressing, it's not automatic. So if you find yourself and you're in the middle of January and you've requested an extension and you haven't received it yet, I think I may start working on my forms that go to employees, because remember, if you don't timely file that form, you could be subject to that steep penalty. On this slide, this is just basically a matrix that we put together to help you go ahead and decipher what you need to do and when, what form you would use, and who it would go to. So again, we talk about whether if you're an applicable large employer and you're fully insured, or you may be an applicable large employer and self-insured, what form you would use, who it would go to, and when you have to send it. Although we have this on this slide, we can also get this form to you in hard copy. And if you'd like to request one, just go ahead and email your JRG representative and we can get the form out to you. So as we come to the near of today's webinar, I'm going to talk about some takeaways that you should be looking at. First of all, you have to know what size employer you are. Remember, if you had that 50 or more full-time or full-time equivalent employees in 2014, you're responsible for this information reporting requirement. It will be, you're reporting 2015 information filed in 2016. You have to know your full-time population. Again, how many full-time employees did you have during the year? Was there turnover? Did somebody come to work for you? Did they leave and did they come back? Were you offering them coverage? So you have to really know all of you have to have all of this data. You have to know what types of coverage that you offered. Did you just offer a MEC plan? Are you self-insured with a MEC plan? Or did you offer minimum value? Because again, this will determine what type of code that 1A or 2A or 2 series that you would be using on your Form 1095C. We just talked about those penalties. Again, you have to keep them in the back of your mind. Have a plan. Know that, you may just be a one-man show, so you may have to say, I've got to prioritize this. I've got to gather this information by this date. I have to start completing the forms by this date. Or you may be lucky or fortunate, have someone to help you. So you have to say, okay, this person is going to get this information and this person is going to do this. We really started today's webinar saying that you really need to have a process into place as to who is going to do what and when they're going to do it. What if you need an extension? Again, don't get caught in a penalty situation because you did not timely file a report. An error, there are going to be errors made, and I think the IRS recognizes that. So just be more concerned that you get that timely filing done. And with that, we're going to go ahead and open up the lines and see if we have any questions that have come in.
Okay, the first question, what about reporting on self-funded HRA and FSA plans?
Well, actually, that is a great question. And I'm going to a little bit of background on that. It's a great question because the IRS has waffled on this reporting, especially for HRAs. This past year, they actually put out one guidance and then they changed it and then they changed it again. As for the health FSA, we'll start with that one first. You don't have to report for that, even though it is a self-insured plan, because generally that is considered an accepted benefit, and accepted benefits aren't subject to the ACA requirements, so you wouldn't have to report on that. As for the HRA, as long as if you are the plan sponsor, we apologize for that. Somehow our line got disconnected, so we had to call back in. So I was answering the question. You asked if for a self-funded HRA or an health flexible spending account. Again, I mentioned the health flexible spending account, it's an accepted benefit, or it should be if you have it designed properly, and you wouldn't have to report for that. For the HRA, as long as you are the plan sponsor and you it is your HRA and it is your underlying major medical program, the high deductible health plan, the PPO, then you do not have to report for the HRA because it's sufficient reporting for the other medical program that you provide. However, if there would be a situation that for some reason you're not the plan sponsor of both self-insured plans, then you would need separate reporting. That would be extremely rare. So great question.
Next question. What about a company with less than 50 employees but have leased employees that are covered under their health plan?
Okay, when we start talking about the leased employees, again, this is where you should have had a conversation with the company that you're leasing the employees from, because we have different requirements under the employer mandate. The requirement is that you have to report for your full-time employees. If these leased employees are not considered your full-time employees, then naturally you don't have to report for them. Where it gets to be a little bit confusing, again, is how the IRS will consider these individuals. So you have to look at your business relationship with the company that you have, that you're doing the leasing from, and have just a really blunt conversation and say, are these your employees or are they my employees? If for some reason the IRS would determine your employees, then you would have to report for them.
The next question. Do we still need to report any health insurance information on the W-2?
Another good question. Actually, and the answer is yes. If you have if you file 250 more W-2s in the preceding year, then on an employee's W-2, you have to go ahead, and it's called employer provided coverage. You have to report that dollar value. So again, this information reporting did not affect that W-2 requirement.
The next question, regarding the lowest cost plan reporting, is the cost to report the actual amount of the plan or the plan amount less any employer contribution amount?
That's another good question. And I think I'll probably have to use an example to go ahead and make it clear. It's the employee-only cost. So let's say that you're offering a PPO. And when you get your bill for the PPO, it says for employee only, it's $300. However, the employee only has to pay $100. What you would report is the $100. That's the employee only cost for that lowest cost plan. So again, it's only what the employee has to pay. And again, we're hoping that that's affordable for the employee.
The next question. Do employers have to post any notices in the office?
That's a pretty general question. As to the employer information reporting, no, there isn't any requirement that an employer post a notice in the office regarding it. However, if we step out of the ACA arena for a minute, there are a lot of posting requirements that an employer has. You have requirements under the Family Medical Leave Act that you have to post. You have requirements under OSHA that you have to post, under the Equal Employment Opportunity Commission as to, again, the ADA that has to be posted. So again, as to information reporting, no, there is no posting requirement. A lot of other areas as to, again, employment-related notices, yes, there are a lot of things that you have to post.
The next question, do I need to include independent contractors?
Well, that again is another good question. Remember, if you are reporting as a large employer who's fully insured, the carrier is going to report for anyone who is covered. So if an independent contractor is covered, the carrier will report that information. Likewise, if you are a large employer and self-insured, you have to report who's covered, so you would have to report for an independent contractor as to having coverage. As to reporting information, though, as to being a full-time employee, technically, under the IRS, an independent contractor, as long as it meets all the requirements, is not an employee. Again, this is making sure that you haven't misclassified this individual. So if this person is truly an independent contractor, not a full-time employee, you would not be reporting for them as a large employer with a fully insured plan.
The next question, how are COBRA participants handled? Sorry if I missed that during the webinar if you already covered it.
No, actually, that was an area that I just kind of shied away for a bit. Again, we have to remind, if you are a fully insured plan and you have COBRA, people who are participating in COBRA, the carrier will report them as being